Hi, my name is Mara Moeller, and the pathology I'm doing is cystic fibrosis, and I'm going to be demonstrating a PA and lateral chest x-ray. Normally, cystic fibrosis is diagnosed at birth with a blood test or a sweat test. It can be evaluated throughout the condition, throughout their life, with chest x-rays, CAT scans, MRI, and or ultrasound. A chest x-ray will show hyperinflation of the lungs and bronchial wall thickening, and as time goes on, it'll be able to show cyst formations, scarring, and lobar atelectasis, and more chest wall thickening and inflation of the lungs. I'm going to be showing you how to take a PA chest x-ray. First, you're going to start off and make sure that you have a 72-inch SID. Make sure that your tube and bucky are lined up. This room automatically lines up and it's detented, and if it's not detented, you won't be able to take your exposure. And the way you know it is detented is the green light will be on. So you're going to take your patient and have them stand in front of the board with their chest facing the board. And then the centering point is your inferior angle of your scapula, or at T7. So you'll bring that down. So you go up all the way so you're touching the board. So right there is her inferior angle. And then you'll want it down her mid-sagittal plane. You roll your shoulders forward and then put the backs of your hands on your hips. And make sure you shield to protect her gonadal area. And make sure you put your left marker on the patient's left side to mark that it's her left side on the image. And then most cystic fibrosis patients are hyposthenic, so you're probably going to be able to collimate down, which I already did. And then once you have them all set up, you can measure, you want to measure where the beam goes through the patient front to back. And she measures 20 centimeters. Then you're going to get your exposure chart out to set your exposure. 20 centimeters puts you at 91 kV and 12 mass. You want to make sure you're on wall bucky, set at large focal spot, because you don't need the fine detail that you would need with bone x-rays. And then make sure you tell her to take a deep breath in, blow it out, and then take another deep breath in and hold your breath. Take the lateral chest x-ray. So you're going to have your patient turn so their left side's against the board, and then put your arms, your hands on the back of your head with your elbows facing forward, and then go so you're close to the board, but you don't have to force your hips into the board. Make sure you use your shield. You also still need 72 SID, and normally for the average patient you need to drop the collimator, drop the tube and the bucky down about an inch. You still are centering at her inferior angle of the scapula. She's about in the same spot, so we won't need to bring it down. And then you want to collimate in as much as you can, and you want to center the vertical line to her mid-coronal plane. And then make sure there's no rotation. Make sure she's standing shoulder width apart. Please step your feet up. So then you don't have any motion. Then you're going to measure patient through her thorax where the beam enters. And she is 25 centimeters. And then for the lateral, you want to put the marker on the anterior portion of the patient up top. Still use the left marker. And then for the exposure factor, she measured 25 centimeters, so you're going to have it set at 91 kV, 16 mass. Make sure it's still on the wall bucky, large focal spot. And once again, tell her to take a deep breath in, blow it out, take another deep breath in, hold your breath, and then she can breathe. And then if they're using AEC, make sure you use the right and left chambers for the PA, and then the center chamber for the lateral. Before taking any radiographic exam, you need to start off by getting 2 patient identifiers, get their name and their date of birth. Then you want to run through pig leg. P stands for pregnancy. If you have a female patient, you need to ask if there's any chance of pregnancy. I stands for indications. This is where you need to ask what's been going on and why we're doing this exam, if there's any pain, surgeries, or known diseases. C and L stands for chronology and location. This is when you ask when and where the issue occurred, and you would need to have them point out on their body where it's at. A stands for artifact. Make sure there's no removable items left on the patient that would end up being in your field of view during the exam. G stands for gown. Depending on the exam, it may be beneficial to have the patient put a gown on and remove the clothing underneath the gown. Once you run through pig leg, you will be ready to begin your exam. Make sure you always explain what you will be doing during the exam to get the best images. Good luck!